Good afternoon. Today we're speaking with Dr. Grant Ralston. Dr. Ralston is a 2019 UMHS graduate. And Dr. Ralston, good afternoon and welcome today. And can you just tell us a little bit about what you're doing right now in your family medicine residency and also your upcoming sports medicine fellowship?
Yeah, of course, Scott. My name is Grant Ralston. I'm currently a third-year family medicine resident at CoxHealth in Springfield, Missouri. I am one of the chief residents this year. I have matched. I will be completing a sports medicine fellowship next year at University of Arkansas in Fayetteville. I've been, lucky enough to have an amazing 3 years here in Springfield. It's an unopposed family medicine residency, meaning that we're the only residents in the entire town. So it's just been an amazing experience, that full scope family medicine training. And I think it prepared me not only for my sports medicine fellowship, but also if I wanted to go on and deliver babies, be a hospitalist, work in the ER, work in an outpatient setting. I think it truly prepared me to, for any of those settings.
Okay, great. And can you tell us a little bit about how you became interested in sports medicine and what are some of your goals for it? It's a fellowship, correct?
Yes. Yeah.
Great.
It is a 1-year fellowship that'll be at the University of Arkansas.
Great.
And for me, growing up, I played about any sport possible. Anything from hockey to football to basketball to track to soccer. I mean, you name it, I played it. Even while on the island, I loved going and watching some cricket matches with fellow classmates, and I still watch cricket whenever I have a weekend off. So for me, I knew I always wanted to do something in the with sports, and then once I realized that I really wanted to work in the medical field, if I could combine the two, I'd work for free. So being able to go to sporting events, work with athletes of all levels, was just a dream come true. So being able to complete that sports medicine fellowship next year will allow me to do that.
And what are some of your goals for the fellowship?
So one of the main goals would be just to sort of equip me with all the abilities to be able to be either Division I athletic team doctor or even a professional team doctor, with sort of all that entails, with being able to really care for the athlete, being able to care for those teams, and being able to have all those resources at my disposal to be able to care for the athletes at all levels.
Great. And I would imagine University of Arkansas, that's a big sports place.
Yeah, it was pretty cool. Since in Springfield, Missouri, we're only about 2 hours away from University of Arkansas. So we have a lot of Razorback fans.
Right, yeah.
Arkansas Razorbacks. We have a ton of fans. So when I found out that I matched at University of Arkansas, I was actually on nights. But when I got to the hospital, they had decorated the OB senior room full of Razorback gear. They had the Razorback stuff everywhere, and the alma mater going on. So it was just a truly unbelievable experience and made me feel loved.
Wow, that's awesome.
Yeah.
Well, again, congratulations. And finally, could you just tell us about one or two things that you really liked most about studying at UMHS and how UMHS has helped you become the doctor that you are today?
Yeah. I mean, I truly believe that I would not be the doctor I am today or have had the success I've had today without attending UMHS. My entire life, school and sports always came easy to me. So going to UMHS, it was the first time in my life that I felt like I was sort of the underdog. And so it was just an amazing feeling to have, amazing professors on the island with awesome backgrounds from all over the world, small class sizes where I was truly able to connect with other classmates, with the professors. And then there's just great camaraderie among all the students. We really wanted to see each other succeed. And
Right.
I still talk to other students all over the country right now that are in fellowships or residencies. And then not only on the island, where you have just this amazing experience. I had never lived anywhere outside of Kansas before going to St. Kitts. So I'll never forget when my wife and I landed. I was like, uh-oh, I don't know what I did here, but we absolutely loved it. We did not want to leave the island when our, 2 years were up down there, and it was just an unbelievable experience. But then even leaving the island, I was lucky enough to have great rotations set up by UMHS all across the country.
Right.
And it really, really exposed me to all different types of healthcare, healthcare systems. And, so I really do feel that I was lucky, and it sort of gave me an upper hand when it came to residency compared to some of my
Right.
classmates who, maybe just stayed in the same city they grew up in. And to this day, when I tell them stories about going to the beach after having block exams, they're like, man, I did it wrong. I should have gone to UMHS. So.
Okay, great. And is there anything else you'd like to say to either alumni or current or prospective students out there about studying at UMHS?
I would just say, it's an opportunity, and just take it and run with it. You never know where it may lead you. To this day, I didn't know for sure what was going to happen. And I remember talking to my parents, it's just an amazing, and my wife, just talking to them how awesome it is that I'm going to be the fellow at University of Arkansas next year, when, just going back 4 to 5 years, I didn't really know what my future held. So I would really say they have all the resources at UMHS. It has all the resources that you would need to become a successful resident, doctor, and really just take it and run with it.
Okay, excellent. All right. Well, I want to thank you so much for your time today, Dr. Ralston. And once again, congratulations on your fellowship. Okay.
Thank you. I appreciate it.